Hello, my name is Kevin Ohlendorf, and I'm the president of the Ohlendorf Appliance Laboratory. In this video, I'm going to discuss some of the different removable expansion appliances that are available for the upper and the lower arches. There are not as many removable options as there are fixed options, but you do have some choices when it comes to the type of removable expander that you can use to create arch form, create space to uncrowd the teeth, or correct a posterior crossbite. In this video, I will go through most of the common upper and lower removable expansion appliances that we fabricate and explain how the appliances work, their components, how and when to activate them, and possible treatment times for each one of them. This video will provide you the information that you need to determine which appliance to use when you treatment plan your cases. Let's take a look at some removable expansion appliances.
The most popular removable appliance to expand the upper arch is this appliance, the Schwartz appliance. This appliance works by turning the expansion screw in the center of the palate. Turning the screw puts pressure on the palatal tissue and the teeth in a lateral direction. This appliance works in the mixed or permanent dentition and can be used for patients of all ages, including adults. The Schwartz appliance consists of Adam's clasp on the first molars for good retention. We normally place ball clasps between the premolars for additional retention. A labial bow is always included to help align the anteriors if needed. We normally place lap springs on the lingual of the anteriors. They are used to help correct rotated teeth as the arch is expanded and the space is made available. The idea is to get as much out of this appliance as possible while the patient is wearing it, so if you can start aligning the teeth with the lap springs, that will be less you have to do later on during straight wire treatment. If you have one or two teeth you want to put direct pressure on, we can use individual finger springs to move them. Normally we include one midline expansion screw. For adult patients, you may want 2 screws to provide more force. 2 screws can also be helpful if you want to expand the anterior region more than the posterior region. You can have the patient stop turning the posterior screw and only activate the anterior one. When you seat this appliance, it should fit tightly. You may need to adjust the clasps slightly to gain as much retention as possible. If the appliance is loose, it may be difficult for the patient to wear, so try to make it fit as tight as possible. If you'd like more information about how to adjust the clasps or any part of this appliance, we have a great appliance adjustment DVD that you may want to order. The screws that we use for the Schwartz appliance are 8mm screws. Each turn is 1/4 millimeter. For most patients, you'll want to have them activate the appliance 1 turn twice a week. They can turn it about 30 times. The screw will come apart if it's turned beyond 32 times. Sometimes this is too fast of a turning schedule for adults. If the patient is riding up the lingual of the posterior teeth and does not fit like it should, you may want to have the patient turn the screw 1 turn once a week. To determine how much the appliance has been activated, measure the distance between the cut and the acrylic. This will tell you how much activation has been done and how much more you can achieve with this appliance. You want to see the patient every 3 to 4 weeks to make sure that the appliance is fitting tightly. At that time, you can activate the lap springs or finger springs to continue to move the anteriors. As the arch is widened, the palate will begin to drop. You'll need to remove some of the palatal acrylic to allow for this to happen. It will take about 3 to 4 months to fully activate the screw. Once the expansion is completed, you'll need to retain the expansion for at least 4 to 6 months. You can use the Schwartz as the retainer or switch to a fixed holding appliance such as the 3D multi-action appliance. The fixed holding appliance will allow you to begin straight wire treatment immediately after the expansion is completed. If you're going to have the patient wear the Schwartz as a retainer, it's important to fill in the space between the 2 pieces of acrylic with more acrylic. This will stabilize the appliance and reduce the possibility of breakage. The Schwartz appliance is the most popular removable appliance that we fabricate. It allows you to expand the arch to create space to uncrowd the teeth and helps to create better arch form. By adding auxiliaries to this appliance, you can start to align the anterior teeth at the same time. The Schwartz appliance is very effective and versatile. A modification to the Schwartz expander is this Transverse expander. This appliance was made popular by Dr. John Witzig. It is used in the permanent dentition for teenagers or adults. There are a couple of modifications. First, there's no labial bow for cosmetic reasons only, but it could be added if you needed it. It has occlusal coverage to prevent the teeth from tipping as the arch is expanded and help with retention. The appliance has two screws. Two screws provide more force and eliminate the possibility that a screw can back up because there's too much force on it. This sometimes happens in adults when the bone is very dense. The transverse expander is also very useful if the patient has a posterior crossbite. The occlusal coverage allows the crossbite to be corrected without interference. We use the same 8mm screws for the transverse appliance. Each turn is a 1/4 millimeter. The patient should turn both screws one turn once a week. This slower schedule will prevent the teeth from tipping and help you achieve a more stable result. It will take 5 to 6 months to open the screws all the way. The expansion should be retained for 6 to 8 months if the patient is older. The patient can wear the appliance as a retainer, or you can switch it for a fixed holding appliance such as a 3D multi-action appliance. Using a fixed appliance will allow you to start straight wire treatment much quicker. For older patients, the transverse expander can provide better arch development and reduce the possibility of tipping the teeth instead of developing the entire arch. The older the patient, the longer you'll need to retain the expansion to prevent relapse. Anytime you have a posterior crossbite, this appliance can be very helpful to expand the arch to jump the crossbite. In some cases, you'll find the patient has a V-shaped or Gothic arch, and you only want to expand in the anterior region. You can do this by using a fan expansion appliance. This appliance has a special screw in the anterior region and a hinge in the posterior. As the screw is turned, the hinge prevents the posterior from expanding, so only the anterior section is affected. This appliance can be used in the mixed or permanent dentition and is effective for adults. The components of this appliance are the same as the Schwartz appliance except for the different type of screw. You can add lap or finger springs to this appliance to align the anteriors in the same way. The anterior screw in the fan expansion appliance is smaller than the standard screw. It's only 4 millimeters. Each turn is still a 1/4 millimeter. The turning schedule for this appliance is the same. One turn twice a week or one turn once a week for adults. It will take about 2 to 3 months to fully activate the appliance. If you need additional expansion, a second appliance may be needed. Once the expansion is completed, you'll need to retain the expansion for 4 to 6 months, just like the Schwartz appliance. As you can see from this photo, as the screw opens, the appliance opens in a V-shaped and will expand the anterior region while maintaining the posterior region in the same width. The fan expander helps to uncrowd the teeth and create better arch form. It turns V-shaped or Gothic arches into good Roman rounded out arches. If you have a case with a true unilateral crossbite, this Nord crossbite appliance can help you correct it. The first thing you'll need to determine is if the patient has a true unilateral crossbite or if he has a bilateral crossbite with a functional shift. To do this, you can use a symmetroscope or observe how the patient opens and closes clinically. Have the patient open about 15 millimeters, then have them begin closing slowly. If the patient closes straight down into occlusion with the unilateral crossbite, then it's most likely a true unilateral crossbite. If the patient closes and the mandible shifts to avoid occlusal interferences, then this is a bilateral crossbite with a functional shift, and the entire arch needs to be expanded. The Nord crossbite appliance is similar to the Schwartz expander with a couple of differences. The first difference is the acrylic is cut at an angle, so it will only push on the teeth that are in crossbite. The remainder of the arch is used as anchorage. This will prevent this side that is in good occlusion from overexpanding. Acrylic onlays are added to disclude the posterior teeth to allow the crossbite to be corrected without interference. The acrylic on the side that is in crossbite is smooth so it can slide over the occlusion. The side in good occlusion will have deep indentations with the lower arch to provide additional anchorage. We can also add a flange to engage the lower posteriors to increase the anchorage as well. The screw for the Nord appliance is an 8mm screw. You want to have your patient turn it one turn twice a week. It's very important to overexpand the crossbite by at least 2mm. These types of crossbites have a strong relapse tendency. Because of this tendency, long-term retention is very important. Once the expansion is completed, you can switch to a fixed lingual appliance such as a 3D multi-action expander. This appliance will hold your expansion as you begin straight wire treatment. You can also activate this fixed appliance to expand the arch more if you need more development. Some doctors will leave this lingual appliance in place for the entire treatment to prevent any relapse from occurring. The Nord crossbite appliance is very helpful to correct true unilateral crossbites. It's important to determine the type of crossbite before you select the appliance you're going to use. Long-term retention is needed with these types of cases. In some cases, you may find that you need a little more expansion to create better arch form or gain space to uncrowd the teeth. Unfortunately, you may already be in brackets and don't want to remove the brackets or bands to use an appliance to gain the expansion you need. In these types of cases, we have developed the pop-in Schwartz expander. It is made to fit around the bands and brackets and does not require you to remove anything. The pop-in appliance is made with ball clasps to fit around the bands and brackets. There is no labial bow to interfere with the brackets. The appliance is very simple and allows you to gain the space you need pretty quickly. You can leave the arch wire in place while the patient is wearing the appliance or remove the wire altogether. It's up to you. The 8mm screw should be turned one turn twice a week. You can get about 1/2 millimeter of expansion each week, so you can judge how long you will need the appliance in place by the amount of space you need to create. You'll want to overcorrect by about 1 to 2 millimeters to account for any relapse that may occur. Once you have completed the expansion, you can continue on with your straight wire treatment. As long as you're in at least an 020 stainless steel wire, you do not need to have the patient wear the appliance as a retainer after the expansion is completed. If you're in a smaller wire, the patient should wear the appliance until you get up to an 020 stainless steel wire. The pop-in design can be very helpful to allow you to quickly widen the arch a couple of millimeters to gain any additional space you may need without having to remove the bands and brackets. This appliance design can be used on the upper or the lower arch. On the lower arch, you are limited in the type of removable expansion appliance that is available. This is the lower Schwartz appliance, and it's about your only option. It works the same as the upper Schwartz. When you have a crowded lower arch and need to expand and upright the posterior teeth, this appliance is very effective. The patient turns the screw to create force to widen the arch. The lower Schwartz has Adams clasp on the molars and ball clasp between the premolars. It has a labial bow, and we normally include a set of lap springs to help you round out the anteriors as the arch is expanded. In this case, we have included an individual finger spring to help move a tooth that is too lingual. This is an 8mm screw, and it will come apart if it's overactivated. Each turn is a 1/4 millimeter. You'll want to have the patient turn the screw one turn twice a week. It will take about 3 to 4 months to expand the arch. After the expansion is complete, you should retain the expansion for 4 to 6 months. You can use this appliance as a retainer, but you'll need to fill in the acrylic cut with acrylic to help strengthen the appliance. If you want to get started with the straight wire treatment right away, you can transition into a fixed holding arch to maintain your development. The lingual arch will prevent the arch from relapsing as you begin straight wire treatment. The lower Schwartz appliance is about your only option for a removable expansion appliance in the lower arch. It works very nicely to expand the arch to uncrowd the teeth and also helps to upright the posteriors as well. Removable expanders provide more flexibility than fixed expanders. You can add all types of auxiliaries to these appliances so you can do more than just expanding. The idea is to try and get as much out of these appliances as possible while they are wearing them, so there is less to do during the next phase of treatment. Let's take a look at some of the auxiliaries you can add to these appliances and what you can accomplish with them. One of the most popular items to add are finger springs. There are two types, lap springs and individual finger springs. Lap springs work very nicely to round out all the anteriors and flare them forward. As the arch is expanded, these springs put a gentle lingual force on the teeth. As the space is created, the springs guide the teeth into position. When you see the patient each month, simply pull the springs out away from the appliance. The patient should feel the pressure of the springs, but it should not be uncomfortable. In some cases, you may have one or more teeth that are too lingual or are very rotated. In these cases, you can put an individual spring directly on these teeth. The individual spring can help you provide a direct force on that tooth to get the movement you need. This spring can also be activated each month. You may want to place a composite button on the lingual of the tooth you're trying to move. This will help the finger spring to engage better and provide better movement. If your patient has a posterior crossbite or you're concerned about opening the bite during treatment, posterior onlays can be added. In the case of a posterior crossbite, these onlays disclude the posterior teeth and allow them to expand without occlusal interference. The teeth slide over the lowers as the arch is expanded. If the patient has very little overbite to work with and you're concerned about the vertical, onlays can also help. The onlays prevent the teeth from tipping and help you control the vertical as the arch is expanded.
Thank you for watching this video on the different types of removable expansion appliances. I hope you found the information helpful. If you would like us to fabricate one of these appliances for you, we will need you to send us a set of upper and lower working models poured in yellow orthostone. If the appliance requires a bite plane or posterior occlusal coverage, please include a construction bite as well. Be sure to check out our other videos on upper and lower fixed expansion appliances. They can be found on our YouTube channel and our website. I hope that you will consider having us fabricate your expansion appliances in the future. There are many different auxiliaries that can be added to these appliances to make them even more effective. If you have any questions about how to design the most effective appliance for one of your patients, please contact us directly and we will be happy to assist you in any way possible. Thanks again for watching this video, and I hope you have a better understanding of the many benefits that come with using removable expansion appliances.